Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to produce the desired outcome. The result is chronic pain, and it's called FBSS, failed back surgery syndrome. It is one of the most frustrating things a patient can deal with, since he or she went the surgery route hoping for a pain-free outcome, and it just didn't happen. Studies show that up to 40% of all back surgeries fail. 10% of back surgery patients actually end up worse than they were preoperatively. Each additional surgery performed has a lower chance of success than the one before. All in all, it can be an exceptionally depressing situation. Why does it occur? Well, there's a few reasons. One is surgery could be performed for the wrong reason. A lot of times, even the best trained pain spine doctors get the back pain diagnosis wrong 50% of the time. Surgery could be performed for the right reason, but the person's left with residual pain. And this may be even from a technically perfect surgery. It might just be, it is what it is. It could be that the surgery was inadequately performed. It might be that fusion didn't occur and the hardware breaks, because the hardware is what's holding it together until it actually fuses. If it doesn't fuse, the hardware continues to see stresses, and the screws or rods can just simply break. It could be that the outcome was satisfactory initially, but then scar tissue formed around the nerve roots, leading to pain. The hardware itself became painful. It could be that levels above or below break down. So any of these can occur, and that technically is more of a delayed failed back surgery. Here's what you see with adjacent segment degeneration. Two levels were fused here. You have screw, 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 screw. You have some fusion here. You can see the bone, okay? But look at the level above. 2 levels above looks great. This is a disc space, a nice rectangle. There's very little disc space left. It's actually almost fused on its own, and then it's degenerated up here. So that's adjacent segment degeneration, okay? What are the symptoms? Well, it's going to vary. Daily back pain may occur. It can radiate into the sides of the back or the buttock. Person may have spasms and aching, leg pain or burning if nerve roots are either pinched or enveloped with scar tissue. So the treatment options for interventional procedures, it may include trigger point injections for the spasms and aching, or injections around the hardware. If that works, then it's most likely the hardware that's causing the pain. Facet or medial branch blocks are injections either in the facet joint or around the facet joint. And this could be very good for adjacent segment, degeneration. Epidural injections if nerve roots are getting pinched, or there's adjacent segment spinal stenosis, or something like that. Radiofrequency ablation is a procedure that you see here where a catheter is put around the arthritic joint. It's heated up and it deadens these nerve endings, and that can help with pain relief for 12 to 18 months. Spinal cord stimulator implant is an excellent last resort option. This has been revolutionary. They continue to get better with the technology. For instance, there used to be problems when you had one and you went from a laying position to a standing position. It would get screwed up. Now they have the new ones don't have a problem with that. You don't lose the pain relief. Now the newest ones are good for both back pain and leg pain. There's over 200 programming options available. Over 3/4 of patients do extremely well with these implants for failed back surgery. Remember, it doesn't fix the problem. Basically what you're doing is you have a battery/programming pack here. The leads go around the spinal cord and emit slight electrical impulses to where you end up getting a tingling sensation where the pain used to be, but it doesn't fix it. It basically masks the pain. So the top non-operative pain managements in Florida are through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. For the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.